Dr. Bush, imagine this. Your body is sending subtle warning signals every day, but most people dismiss them. Fatigue, constant thirst, blurry vision. These aren't just annoyances. They could be your blood sugar screaming for attention.
Exactly, Dr. Stex. And here's the kicker. Many won't even notice until it's too late. High blood sugar is silent but dangerous, affecting your heart, kidneys, and even your brain. Today, we're breaking down 10 signs that your blood sugar may be too high before it becomes an emergency. Sign 1. Increased thirst.
Let's start simple. Number 1, persistent thirst. We're talking about that I can't stop drinking water kind of thirst. Your body is trying to flush out excess glucose through urine, but most people just think I'm thirsty because it's hot and ignore it.
And it's not just occasional thirst. We're talking every hour, every day. If your water intake has doubled and you're still dry-mouthed, that's a huge red flag. Your kidneys are working overtime because your blood sugar is too high.
Right, and this can spiral into fatigue because your body is constantly losing fluids. People underestimate how dangerous this combination is.
Sign 2. Frequent urination.
Which naturally leads to sign number 2, frequent urination. The medical term is polyuria. Basically, your body is trying to get rid of excess sugar, and that sends you running to the bathroom.
Exactly, and it's not just once or twice a day. We're talking waking up multiple times at night, interrupting your sleep. That sleep disruption alone can worsen blood sugar control.
And most people just chalk it up to drinking too much coffee or water. But if it's consistent, it's a signal you need to check your blood sugar immediately.
Sign 3. Blurred vision.
Sign 3. Blurred vision. High glucose levels pull fluid from tissues, including the lenses of your eyes, affecting your ability to focus.
And this isn't minor eye strain. Imagine trying to read a text message or drive and suddenly things aren't sharp. This can precede serious complications like diabetic retinopathy if left unchecked.
People often ignore this because it comes and goes, but repeated episodes of blurry vision should always trigger a blood sugar test. It's your body waving a red flag.
Sign 4. Fatigue.
Sign number 4, fatigue. Not your usual tiredness, but a deeper, draining exhaustion that doesn't improve with rest.
High blood sugar prevents glucose from entering your cells efficiently. Your body's energy production slows down, leaving you constantly tired.
And this isn't laziness or stress. If you notice persistent exhaustion while doing regular tasks, that's your metabolism screaming for help.
Sign 5. Slow healing wounds and bruises.
Sign 5. Slow healing cuts and bruises. Even minor injuries can linger for weeks.
This happens because high sugar impairs circulation and weakens your immune system. Your body can't deliver nutrients efficiently to injured areas.
And it's not just a cosmetic problem. This can turn into infections if ignored. Everyone should take note if cuts aren't healing like they used to.
Sign 6. Unexpected weight changes.
Number 6, unexpected weight loss or gain. Some people shed pounds rapidly, even while eating normally.
That's because your body can't properly use glucose for energy, so it starts breaking down fat and muscle. Conversely, some people gain weight due to insulin resistance.
It's a confusing signal, but either extreme, loss or gain without changes in diet or exercise, warrants checking blood sugar.
Sign 7. Increased hunger.
Sign 7. Constant hunger. Your body's cells are starving for glucose, so even after a meal, you feel ravenous.
This is called polyphagia. It's tricky because many think it's just a snacking habit, but persistent, unexplainable hunger can indicate chronically elevated blood sugar.
And when combined with fatigue and thirst, it's a clear metabolic signal that something's off.
Sign 8. Tingling or numbness.
Sign 8. Tingling or numbness in hands or feet. High glucose can damage nerves, causing neuropathy.
You might feel pins in needles, burning, or complete numbness, and many ignore it because it's subtle at first.
Early detection is key. Left untreated, nerve damage can become permanent and affect your mobility.
Sign 9. Recurrent infections.
Sign 9. Frequent infections. High sugar feeds bacteria and yeast, making infections more common.
This includes urinary tract infections, skin infections, and even gum disease. If you notice recurrent infections, check your blood sugar immediately.
People often treat symptoms individually but ignore the underlying metabolic issue. That's dangerous.
And finally, sign 10. Dry mouth and skin.
And finally, sign 10. Dry mouth and skin. Chronic dehydration from excess urination affects your entire body. And this isn't cosmetic, it signals that your body is under stress. Cracked skin and persistent mouth dryness are subtle but important clues.
Combined with the other 9 signs, it paints a clear picture of high blood sugar. Don't ignore it. Early detection can prevent severe complications.
So, Dr. Bush, if someone recognizes even a few of these signs, what's the first step?
Test your blood sugar, consult a healthcare provider, and don't wait for more signs to appear. High blood sugar is manageable, but timing is critical.
Exactly. Awareness is the first defense. Recognize the signs, take action, and protect your health before it escalates.
High blood sugar doesn't wait, and neither should you. Listen to your body and take control today.
And Dr. Bush, before we finally wrap this up, let's address something very important. Many people feel these symptoms, but they keep postponing testing. They say, "I'll check next week." That delay can cost years of healthy living.
You're absolutely right. High blood sugar doesn't usually collapse someone overnight. It builds quietly. The damage to nerves, blood vessels, kidneys, it happens slowly, silently. And that's why awareness is power.
Let's make this practical. If someone is watching right now and suspects high blood sugar, what should they actually do today?
First, don't panic. Second, get tested. A simple fasting blood glucose test or random blood sugar test at a clinic or pharmacy can give clarity. Third, begin lifestyle correction immediately, even before results come back.
And by lifestyle correction, we're talking about reducing excessive sugar intake, cutting back on sugary drinks, controlling portion sizes, increasing physical activity, and staying hydrated properly.
Exactly. Even brisk walking for 30 minutes daily can significantly improve insulin sensitivity. The body responds faster than people think when you take consistent action.
And let's be clear, this is not about fear, it's about responsibility. Your body gives signals. The question is, are you listening?
Well said. If you're constantly thirsty, urinating frequently, feeling drained, or noticing vision changes, don't normalize it. Investigate it.
Because early action can prevent complications that are far more expensive, painful, and life-altering.
High blood sugar is manageable. In many cases, it's preventable, but ignoring it is dangerous.
So today, make a decision. Not tomorrow, not next month, today.
Know your numbers, protect your health, and take control.
Your future self will thank you.